All right, and oh, pop. Felt a pop in the low back squatting or deadlifting. It's not uncommon. A lot of you guys struggle with this. I get a lot of messages about this. You're stuck in this forward position now. Difficult to get up straight. You're crawling in bed like this. It's a nasty position. Your low back is crying. What I want you to do is exactly what Julie just did, okay? You might need to give it 1 to 2 days to calm down, but as soon as possible, if you're in that stuck forward position, I want you to just lay down flat on your belly. I guarantee you this is going to be tight and it's going to be achy at first. What you want to ensure happens is as you lay here, the longer you lay here, it relaxes as you are here. It should get more comfortable the longer you lay here. Make sure you're not flexing your glutes, squeezing the low back, trying to fight against it. Don't do that. You're going to make things worse. Just breathe. Breathe into that belly. Breathe into the low back. Let things calm down. Let everything mellow out. Just let it melt away. If you're doing that and you're laying on your belly, and the longer you lay here, the better you feel, it's a great sign. It's a very, very good sign. Over time, then you can progress up to the elbows. So now let's start to come up. Remember, you initially started stuck forward. We're trying to get you out of that position. So now we can arch up into this position. Same thing. Now that we're in a more extended position, it might be a little bit tight and achy at first. It's not uncommon. All of my online clients go through this. These are stages that we go through with our clients all over the world, dealing with low back issues, popping that disc during squats or whatever, okay? So relax in this position. Don't flex the glutes. Don't flex the low back. Hang out here. Breathe into the belly. Maybe you do this for a couple days, okay? And you get used to this. Now, awesome. Mobility's starting to return. You can hang out here. You're comfortable. Now let's start to activate the core a little bit. All right, so we can roll over onto your back. This is after we start to feel okay. After that sciatica is calming down and disc herniation pain's calming down a little bit. This is part of our method. So now we can start to prime the core a little bit. What you're gonna do is gently push the low back into the floor. Gently, start gentle, okay? Don't push super hard. Remember, we're kind of in a sensitive state, recovering quickly, in acute condition. So gently push that low back into the floor. Now all you're gonna do, it looks simple, but it's very important, is just lift one leg at a time. Just one leg at a time. Nice and slow. Nice and slow. And we'll do this on each side while you're keeping that low back pressed into the floor. That is the crucial component. If you feel like it's a little bit uncomfortable to push, then push a little bit less. Find the amount. You want to push as much as you can, the low back into the floor without producing symptoms. Going through these leg lifts. This is going to help start to get the core engaged again, start to push the low back a little bit, start to tell it, hey, it's okay, we can put some force on this. Once we get you to this point over the first couple weeks, it's typically very smooth sailing from here with the right plan. So if you are someone who recently has felt that pop in the low back and it's difficult to stand up straight after squatting or deadlifting, this is the initial stages that I would take you through, and this is what I would recommend you try to get some initial relief. And as always, if this can only get you so far, visit the bio, the link in my bio or in the description of this video, so we can become a team and we can learn how to take this a little bit further, okay? Because I'm here to teach you how to fix your low back wherever you are in the world through the right plan so that you can avoid drugs, injections, and surgery, and we can get you on a plan to success. So use this method. It works. I promise you it works. Like the video, subscribe, share with a friend. Let's fix your low back.